Mom. Today we have two new teen moms to introduce to you. The focus of today's session will be discussing RH incompatibility and hemolytic disease of the newborn. Many of you may not know that prior to the 1960s, these complications were the leading cause of infant morbidity and mortality. After the implementation of screening between 1970 and 1979, RH-related diseases fell from 40.5 cases to 14.3 cases per 10,000 total births. RH disease now accounts for only 0.33% of the combined stillbirth and perinatal mortality rates.
The United States Preventative Services Task Force strongly recommends RH blood typing and antibody testing for all pregnant women during their first prenatal visit as a grade A recommendation. Repeated RH antibody testing for all unsensitized RH negative women at 24 to 28 weeks gestation, unless the biological father is known to be RH negative, is recommended as a grade B recommendation. Screening consists of a simple blood test to determine if the mother is RH positive or negative. If she is negative, then an indirect antiglobulin or Coombs test is performed to determine whether she has been exposed to the baby's blood and is sensitized to the RH factor with RH antibodies. If she is unsensitized, the father is screened for RH factor. If he is negative, there is no incompatibility risk. If the father is positive, another Coombs test for the mother is performed at 24 to 28 weeks. If the father is unknown, the blood type of the fetus can be identified through amniocentesis or a newer non-invasive test called a polymerase chain reaction. 3% of cell-free DNA in the plasma of pregnant women is of fetal origin, and PCR allows for the DNA to be isolated so that the blood type can be identified.
The risks for the screening procedure include those associated with any procedure involving a blood draw. Some mothers can experience anxiety related to the potential complications of being incompatible. The limitations of the Coombs test are that further testing is required to determine whether the mother and the baby are truly at risk, which incurs more cost and more time. The overall cost effectiveness of screening has not been established. If further screening is necessary, amniocentesis poses significant risks, which should be heavily weighed by the patient and the provider, as PCR has been established as very low risk and 99% effective. One controversy surrounding this topic is that one study stated it is 16 times less cost effective to screen for incompatibility rather than just provide postpartum treatment. However, another study stated that the screening costs only $15 and the treatment actually costs $111 per patient. This issue remains to be debated, but here at Teen Mom, we follow the USPSTF guidelines. There is, however, a universal recognition of the efficacy of screening for RH incompatibility and its ability to recognize a potential important problem. Now let's meet our moms.
Hi, I'm Gracie. I'm 16 years old from Barberville, Kentucky. This is my first pregnancy and I don't know who the baby daddy is. I wasn't planning on this happening to me, but it did. And now I'm trying to deal as best I can. I don't know what the risks are for my baby, but I want to get everything tested since I don't know anything about that daddy's medical history. I just really want me and my baby daddy to be okay.
Welcome, Gracie. What you have just described fits perfectly into our health belief model. People will act to avoid a health threat if they believe it to be serious and if the benefits outweigh the perceived barriers. In your case, you underwent RH testing based on the belief that incompatibility would be a health threat to your developing baby. Now let's meet mom number 2.
Hi, my name's Sarah. I'm from Los Angeles, California. This is my third pregnancy and I have bouncing baby boys due any week now. I'm so excited. But I do have a story to tell you. I became pregnant for the first time when I was 15. And unfortunately, after a few weeks, I lost that baby. When I was 16, I found out I was pregnant again. But I was afraid this time to tell my parents because I thought they'd be disappointed in me. When I was about 7 months pregnant, I stopped feeling the baby move, so I decided it was time to tell my parents. I wish I had known the importance of prenatal care earlier because I lost that baby too. But I know that I'm willing to do everything I can to make sure this time I am able to take care of myself and my babies for the future.
story is not meant to scare everyone, but we asked her to be a part of this group today to emphasize the importance of screening for RH incompatibility. Proper prenatal care goes above and beyond nutrition and includes screening for RH factor. Can you tell us a little bit more about this experience, Sarah?
Of course. Sorry. My blood type is A negative, meaning that I am negative for the RH antigen. My boyfriend is O positive, meaning he's positive for the RH antigen. I don't really know how I had the first miscarriage. I just believe it was God's way of telling me that I just wasn't ready for a baby yet. I have been told that after the miscarriage, I developed antigens to the RH antigen, or antibodies to the RH antigen, sorry. When I became pregnant for the second time, the antibodies I produced attacked my growing baby, causing hemolytic disease, and ultimately caused the baby to die too. Now that I am pregnant again, I am receiving RH immunoglobulin in order to protect my growing twins from any antibodies.
That's right, Sarah. You have a very good understanding of RH incompatibility. RH incompatibility in an RH negative mother can result from exposure to the RH positive blood. This includes blood exposure that can occur with a miscarriage like you had. The antibodies formed from exposure stay in the blood of the mother, making a second or later pregnancy more dangerous if the second baby is also RH positive. Now we need to take a quick break, but we'll be back in a few.
Are you pregnant and unsure about your options for prenatal care and RH screening? The current RH screening recommendations have influenced health policy to enhance compliance. Medicaid is available for low-income individuals and provides prenatal care assistance programs. The government also provides funding to many maternal health clinics serving low-income and disadvantaged populations through the Title X funding program. Ask your CNL for more information about obtaining these services today.
Welcome back. Now let's discuss some strategies to help facilitate adherence to the screening guidelines for expecting mothers. Our first strategy that we plan to implement to facilitate your adherence to the RH screening guidelines, as well as your overall prenatal care, is a text message communication system. With our text message system, we will provide positive reminders and educational messages for a healthy pregnancy. This will be offered in both English and Spanish, and a number to your OBGYN office will be provided so you can call whenever you have questions. This system will work as a cue to action, which is a construct of the health belief model. This will reduce perceived barriers while increasing perceived benefits for our expectant mothers.
Our second strategy is to provide culturally competent care when interacting with expectant mothers. Can either of you offer any advice for interaction with a specific population of teen mothers?
Don't judge me because I'm young and pregnant. I care about the health of my baby, and I want to know about risk factors and take part in health screenings.
Well, this third pregnancy, I've actually had a wonderful experience with my healthcare providers. They have treated me as an adult and provided me with tons and tons of education throughout my entire pregnancy.
That was very insightful, girls. As nurses, it is important to be culturally competent about the populations we are serving. This will ensure positive nursing care results in the best patient outcomes. Within the teen population, it is particularly important to provide autonomy and confidentiality.
Gracie, you shared with me before the show that you had some statistics that you wanted to share with the group.
Of course. I know what the topic of today's discussion would be, so I did a little research on my own with the help of Megan. I was interested in knowing how many teens actually receive prenatal care, which encompasses RH screening. From research, I found that only 65.4% of females under the age of 18 receive prenatal care within the first trimester, and that African American teens have worse adherence with only 58.6% receiving prenatal care. Also, 5.6% of African American women receive late or no prenatal care compared to 2.2% of white pregnant women. As a white woman, I have the highest risk of RH incompatibility because 15% of white women are RH negative. 3.5% of African Americans are RH negative, and RH negative is rare in Hispanics and Asians. That's all you wanted me to say, right, Megan?
Very good.
Thank you, Gracie. It is also important to note that the prevalence of adherence to the recommended RH screening guideline is below the desired standard. The risk factors for teen mothers include perceived barriers such as denial, lack of time and family support, or lack of education of the importance of prenatal care, specifically RH screening, as documented on the CDC's website. Another important consideration is that in some populations, such as Jehovah's Witnesses, they do not want to receive blood products and may not want to receive the RH screening because they don't want to know that their baby is at risk for a potentially fatal disease where all treatments involve blood products. This type of complex situation requires sensitive education by the CNL about perceived barriers versus perceived benefits.
To expand care to the underserved populations, the Affordable Care Act offers a loan repayment benefit to healthcare providers who will work in these areas. This will help to increase adherence because of the increased access to prenatal care that they will be providing.
So does that mean here in LA, I can tell my friends that there are lots more clinics that they can go to get screening so they don't end up like I did my first 2 pregnancies?
Absolutely.
Thank you, Gracie and Sarah, for being our guests on the show this week. We look forward to hearing about your children and how everything is going in the future.
Next week on Teen Mom, we will be discussing the importance of breastfeeding and kangaroo care in newborns.
We hope you all have enjoyed the show and learned a lot about RH incompatibility screening.